Hi guys, in this video we're going to talk about the absolute best acupressure technique you can do after you get your surgery, okay? And so I'm going to bring my volunteer. Thank you for volunteering. He loves volunteering. Okay, so I've had quite a few surgeries, unfortunately. I had my left shoulder completely fractured. I had to get that handled, my left elbow. So what happens, whether you get a hip surgery or a broken bone or some type of surgical procedure, it's almost like a trauma because they have to go in there and manipulate stuff. Of course, the actually original injury is a trauma, but then it's kind of a double trauma to the adrenal glands, because the adrenal glands, they never go to sleep, so they have to constantly work. That's why sometimes they have to give you a potassium IV when they do surgery, because you dump a lot of potassium, because the adrenals have to, they actually are working behind the scenes a little bit, okay? Okay, but here's the point. Whether you injure yourself or have a surgery to a joint, for example, to a certain degree you lose communication lines, neurological, blood flow, lymphatic, etc., okay? And a lot of times after the surgery you get rehab, and it's months and months and months, and it takes a long time. This technique that I'm going to show you will speed things up dramatically. And I did it to you can do it to yourself, okay? Well, it's a little difficult on the shoulder, but let me just explain it. What you do is you don't work on the same shoulder. This has been traumatized. It's kind of like taking your thumb with a hammer and smacking it and then massaging your thumb. That wouldn't be smart. Now, because the body is on a circuit, which means a circle, the nerves come down from the brain and actually come to this side, cross over to the spinal column, and go to this side. So you have the nerves on this side are connected to this side. The hip bone's connected to the thigh bone. The thigh bone's connected to the... But here's the point, and the reason for that is that helps you coordinate between left and right and front and back. So when you're walking, this arm is in coordination with this to swing the arms back and forth so you can run. So you have these on-off switches that constantly are helping you coordinate and relax and contract, relaxing, contract. And because you have these circuits from this side and this side, you can actually affect this side by working on the opposite side. You won't believe me until you do it, but I want you to try this. So let's say, for example, he had surgery on his bicipital tendon right in the front right here. This is the little tendon that goes through his bicep that allows this arm to go up like this. Let's say they reattached it right here. Okay? Now you have to kind of know your anatomy and know where exactly they did the surgery. Let's say they put a little staple right there into a certain part of the bone, and then that's where the trauma was, okay? What you want to do is press on the exact mirror image side on the left side, okay? Now, here's the thing. When you press on the opposite side, which by the way is the good side, it's going to hurt like hell, okay? I don't want to get into why it's going to hurt like hell, but you're going to find the good side will hurt more than the recently traumatized side. Yeah, okay. All you need to know is you can use that to make sure that you're on the exact the correct spot. So in other words, what you should know is the opposite mirror image point, mirroring where you had the trauma, the surgery, is going to be very, very sensitive, okay? So you're looking for that spot. As soon as you find it, you're like, oh my gosh, there it is. And then you just massage that. You don't have to do it really hard, but just massage it for like a minute, okay? What you're going to find, you're going to regain more circulation on the bad side, neurologically, and blood flow. And if you don't believe me, go ahead and try it and see for yourself. You're going to speed up the time of recovery. You're going to see more circulation. You're going to see less inflammation, and you're going to see less pain. So, if it's in the elbow, wherever they put a screw in, you work on the opposite elbow. Let's say it's the collarbone. Let's say he broke his collarbone right here. Well, guess what? You work on the opposite collarbone, mirror image side. Same thing with the foot, the toe, a finger, a hip. Work on the good side. No one does this, but it's so powerful after a surgery when you're trying to heal that it'll really speed things up and give you a lot of relief. Okay? It'll just cut down the time of healing. I'm not saying don't continue the other therapy, but this is the icing on the cake. Now, the other thing is that let's say the surgery was in the lower back, okay, right in the center. What do? You work on the front, right at the level of exactly where that surgery is. So the belly button if you look on the back, is at the third lumbar vertebra. So if it was at L5, we go down a couple inches below the belly button. But you know how to find the mirror image point because it's going to be very tender. So you work on the point in the front, and you just work that out, and you're going to get a lot of relief. If you had surgery, for example, I don't know, on the head right here, you can work on the opposite side. And when I mean by work on it is an acupressure massage. You can just, it doesn't even have to be of a certain pattern. You just need to massage it in any which way you want for like a minute, and do that each day. And the more you do that, the more it's going to speed things up. Okay? So just try it. Put your comments down below. I want to hear them, and then everyone can see if it really does work, which it does, because I've tried it out about 10,000 times before. All right, thanks for watching. Hey guys, I wanted to personally invite you to a new Facebook group that I just started called Dr. Berg's Keto and Intermittent Fasting Lab, okay? So I created this so we can share our successful actions, what worked, what didn't work, your results. So I put a link down below. So go ahead and sign up, and I'll see you inside.